Hello, I'm Lisa Turlington, the Executive Director of the Sampson Community College Foundation. Today we continue with the Sampson Showcase Series with Dr. Paul Viser, one of the directors of the foundation, talking with Wanda Capps, who's the Division Chair of Health Programs.
Anyway, thank you, Lisa, for introducing me, and it's good to sit here with Wanda Capps. She and I go back a long way at Sampson Regional Hospital. Some 25 years. Neither of us was gray at the time, but things have changed over 25 years, and I can tell you that I've always been amazed at the skill level of the nurses at the hospital. And if you don't believe it's a team effort in the hospital when people get sick and things start going bad and people need expert assistance. If you don't believe it's a team effort, you need to observe sometime. I hope you don't have that chance, but if you see it, you'll see how important each cog of the wheel is. One of the things I've observed over the years is that there's quite a bit of turnover in nurses, and that's true for other personnel as well. The reality is we have to have a steady supply of new trainees coming into the hospital, and not just that, but the offices that are occupying this town and the county. If it weren't for this college, I hate to think what kind of a mess we would be in. I think we'd be struggling to fill our staff positions in the community at large. How do you do it? How do you attract the students to come to Sampson Community College?
Well, being a community college, you know that most of our students are our students. They are our county or they're in our service area, and they're students who are going to stay here. So it's not hard to attract. One thing that we have found lately is we're getting a lot of calls about you're nationally accredited, and I want to go to a nationally accredited program. So we are getting a lot of students who are focused on that. They also look at passage rates, and I'm proud to say we have a faculty who works very hard. Our PN past 3 years passage rate has been 100%, and our ADN program has been 91, 100, and 100. So we're doing well with that, and I think that's why they come to Sampson Community College.
I'm curious, I see more and more men going into nursing.
Yes.
What are your numbers on that?
We typically have 2 to 3 male students, and we like to attract the male students to come in because there's always a place in nursing, as you know, ER, OR, and other places. So we do have male students here.
Yeah. Well, being a small town, most of our students are going to come from the local high school students, the local population.
Right.
So it's that's what we work with, and it's striking to me, and it has been for all this time, just what can be done with the right educational opportunities. Young adults coming right out of high school and getting the training that they need to serve our patients in many different settings.
You spoke of opportunities. Let me talk about some things here that we have for students who want to go into health care. Typically they want to come here to be a registered nurse or a licensed practical nurse, and we have both of those programs here. The exciting thing we have is we also have an opportunity where students can come in once they complete their LPN degree and seamlessly go into our RN program, do another 3 semesters, and complete their associate degree in nursing. The exciting thing we're starting in the fall, and we're starting with a small number, is we are doing a PN to ADN online option. So this will be an option for licensed practical nurses to take their coursework online, and their clinical will be precepted out into the community and at hospitals. So we're starting that in the fall, and we're starting with a limited number, and hopefully next year that will grow so we can accept more, because more and more hospitals only want registered nurses. instead of licensed practical nurses. So we're trying to provide an opportunity for people to complete that degree as well.
What would be the advantage for a student to go through the PN program before the associate RN program?
A lot of students have that need to complete something, maybe family, their family situation.
I see.
They may have lost their job and have a set amount of time where they have to complete a degree. Most often that would be the instance, that people would like to do that PN degree.
Yeah, I agree that from my observations, RN is definitely where you want to be. I know of a few cases where people did exactly that for the reasons that you stated. They were under pressure to complete a degree program, but they found themselves really not having as many opportunities as the RN graduates have had.
And we're starting to see that even if you have a 2-year degree as an RN. So we're trying to provide another opportunity for students to advance. The community college system has a articulation agreement with the 4 universities now. So we know exactly what courses a registered nurse has to take, so that when they finish here, they can automatically go into an RN to BSN program at one of the 4 universities, North Carolina systems. We also have something called Ribbon, and that stands for Regionally Increasing Baccalaureate Nurses. Students come here, they take a set number of courses, they're admitted into our program. If they meet the criteria, they can also be admitted to Wilmington. The first 3 years are here. They graduate with their associate's degree in nursing. They take their state board exam. Their last year is all completed online at Wilmington and graduate with a 4-year degree, 3 years of community college cost. So we're excited about that.
A bachelor's degree?
Yes, sir. So we're excited about that. And this is our first year. So right now we have, I think, 2 students are sticking it out so far.
Wow. Well, I'm curious. Many of the students whom I've known over the years are have started their adult lives. They might be married, parents, struggling to keep their day jobs, trying to work at night. They have so many challenges. I wonder, are there scholarships available to help at least on the financial side for the students?
The community has been most generous to nursing, and yes, there are many, many scholarships through the foundation, through the work you do, and others do. There are many scholarships available for students.
Because it amazes me how they do with the challenges that they have.
Yes,
when I was coming along, I didn't have anything to worry about except being a student. I gave that my 100% attention, and
It is a challenge.
Some of these young adults are impressive in what they're able to do as parents and as breadwinners and as students, and coming out here at night and getting home late, trying to get in enough sleep to do it all over again the next day.
They are to be commended because they do work hard, and they do have all that baggage, if you want to call it baggage, but they have families, and they do have to work to continue to provide for their families while they're students.
Well, now, tell me about some of the allied health fields, like do we do radiology, tech, or nuclear training at all, that type of thing? Unfortunately,
we do not. We hope to grow. We have nursing assistant. Phlebotomy is offered through continuing ed. Our hope is to start a medical assisting program for students who may not want to be a nurse, but they want something in the medical field. So that's our next challenge, is to start a medical assisting program.
Well, now, is that required for most doctors' offices, the medical assistant training and certification?
I don't believe so. You might answer that better than I do, but I don't think so. I don't believe so. But some facilities, I guess, would require that. I know clinics who've been, maybe have been bought out by bigger facilities like Chapel Hill or Duke or Rex or somewhere may require those individuals to have medical assisting in order to be employed.
Yeah, that would make sense.
Yes. Yes. What can you tell us about the foundation? What else y'all have?
Well, the foundation is a fundraising body, in a public relations body of the college. We don't run the college. That's left up to the Board of Trustees and the president and the faculty. But we try to work with the grassroots enthusiasm that already existed in this community long ago for this institution.
Right.
And we try to stoke that enthusiasm and build it in various ways. Some fun events like golf tournaments, and the phone-a-thon has been fun over the years. But our fundamental purpose is to support the college financially and to encourage others to do the same. We've made some advances in recent years, but we feel like there's room to grow in that area, and we're trying to connect with more people throughout the community. I think many people really, if they haven't had direct contact with the college, they don't realize what a central role it plays. It not only is geographically probably the center point of Sampson County, but it's the center point in other respects as well. It's a major institution, and draws in people from all over the county and some from other counties. We need to support it. It needs. There are new programs that need to come up.
Right.
There's some others that aren't needed anymore. They've been phased out over the years, and some new ones that need to come forward, and that's where you come in, Wanda. I'm sure you have a better feel than I do about what the county needs and what we need for the population of our county. I mean, it's the largest county in the state
Right.
by land area. And it's not a small county by population. What is it, 70-some thousand?
I have no idea. I don't know. I don't have any idea.
But anyway, and there are very few people who are not at least indirectly contacted by what goes on in this institution.
Well, we certainly appreciate what the foundation does, not just for our students, but for the faculty, because they are most supportive. And we certainly appreciate you spending time with us today to talk about medicine and nursing and health programs, and we certainly
thank you.
appreciate what you do for the college.
Thanks, Wanda.
Thank you, Paul and Wanda, for sharing that with our viewers. We are very proud of the nursing programs here at the college, and we appreciate you letting our viewers know how important your programs are to this community. To learn more about the nursing programs at the college, you can check it out at sampsoncc.edu.